I thought I'd start with just putting emotional lens on this for people who may have had a recent COVID infection and not thought anything about it. But when you feel that you've recovered and then actually 2 months later, you start feeling really ill and flu-y all over again. But this time you feel like your cells are actually poisoned. And you start becoming less and less functional as a human being as cognitive ability and energy decreases, which makes it really hard to continue working at the level that you previously were accustomed to. So this was my experience in 2020 after a COVID infection. This is just mine, but it represents a large proportion of the community of long COVID now that are not recovering. But if you're like me and you are interested in data, I decided to take all my health interaction data over the course of 2020 to explore a health customer journey, particularly with having corporate health insurance. I had access to lots of different specialists, and yet I spent a quarter of my working life trying to find healthcare that today still doesn't exist. The costs were rapidly increasing. And just to paint a picture of where we are in the UK versus the US, we're experimenting with 5% of what is currently being offered in the US at the moment with long COVID patients. So this is still very small in comparison to what I know many of the peers in the US are spending. But I spent 3,500 of my own money, and people spent the rest in order to find and have consultations across 9 different therapy areas. And all of those were trying to piece together this emerging pattern that I was tracking through the Zoe app at the time, that I had daily severe symptoms of around 20 to 30, and these kept increasing over time. I kept finding that I was adding more and more symptoms into the app that Zoe wasn't tracking. So it painted a really complex picture of a sort of post-viral reaction to COVID that we now know as long COVID. And the data visualizations that I created to try and make sense of it all can be seen at thisiswellness.com, where I was also exploring this need for another type of language that wasn't just focused on wellness, because I certainly wasn't feeling like I could go and exercise or that my mental health was going to have any impact on these biological symptoms that I was experiencing. And then gradually, as the years went on and I got another COVID infection and I became more immersed in the community through social media, and I discovered a whole world of people who were collaborating online, sharing the reality of their lived experience. We were also seeing daily, initially, in the press, before there was almost a sort of a blackout from talking about COVID. But now we've moved from not talking about COVID to placing the blame on people who aren't recovering, and all these headlines, not particularly nice to see constantly coming out of the media when you're so sick and you don't have any healthcare that is available to be able to tackle this complexity. Create a sort of them and us culture between people who can't recover from long COVID versus those who supposedly can, but we will see later that might just be an illusion. And the reality is much more serious. COVID is a vascular disease. It's definitely being transported, the virus SARS-CoV-2, around the body on this superhighway of blood vessels, which means it can turn up in any place in the body, particularly if you've got some vulnerability already. We know that every COVID infection is causing brain damage, reducing brain cells, and we've seen the continuous similarities and synergy between what people with ME had prior to the pandemic, many of whom are still bedbound with this disease. 25% of the ME population are severely impacted, and it's been interesting watching a sort of younger generation try and find new language around it, which is where bed rotting has become a TikTok trend, with teenagers trying to explain that they're not just having fun duvet days anymore. They literally can't get out of bed and they can't function. So we really need to pay attention to the lived experience to understand what's happening, because we are not serving this population at all at the moment with our long COVID clinics. People are unsafe in healthcare because we've dropped all the masking. The level of medical gaslighting because of doctors not knowing how to help has really just become the average, almost the expected experience, which should not be the case. And we're seeing an increase from the ONS results of people who have long COVID, aren't recovering, and now it's affecting them on a daily basis. Globally, the last estimate stood at 400 million of long COVID, but really that's just people who know that they have a damage from this virus. What we're not seeing is what's happening underneath, and this is what's really driven me for the last couple of years, this particular image. Having been someone who is working on climate change and understanding finance, climate systems, I strongly feel that COVID is causing climate change to the human body. So we really need to start looking at why this is happening. But healthcare professionals who are currently not being educated on this emerging science, bioscience, is a serious problem because they weren't taught it at medical school. Unfortunately, there's a default to being really protective around what they were taught and not learning or listening to patients or emerging researchers in this space. On autopsy, this virus was found in 84 different places in the body, live virus, a year at least after infection back in 2022, whilst people still had vaccines. So the research has just been getting worse and worse. We know that when you put long COVID patients into private labs in the US and they have inflammation scanning, you see a body literally on fire and a brain. But yet what we don't have at the moment is blood tests that even show that there's a problem. Standard blood tests for most long COVID people will not show that there's an entire problem in the body, which should signal alarm bells, because we are not creating a research health system at the moment to be able to see any of this. And our immune systems were definitely not designed for multiple hits of this virus, which is an airborne SARS virus, at least once a year now. In the last year, long COVID has doubled in children, and this repeated infections model should worry every economist and policymaker. In December last year, there was a Canadian research paper that looked at the population level of long COVID, and they discovered that after 3 infections, which could be known or unknown because of the asymptomatic features of the virus, 38% had or have had long COVID. And we're just following this almost blindly at the moment, and we've had 2 pretty big COVID waves since then, so we could be more like at the 50%, which is clearly not good, and we don't know what the future holds. This level of reinfections of an airborne SARS virus has never been studied before, but this is where we're heading. And then just as a really quick summary, the cumulative risk from every infection is increasing the risk of getting long COVID. There is definitely silent damage happening in the body. We know that in the global south, there's a lot of long COVID that's wrongly being diagnosed as TB. We know that in the north, the equity disparities are already playing a part in recording more cases by GPs in the north versus the south. And we know that although we currently have this reliance on vaccines, they're not enough. They're not designed to stop infections, which means they will not stop long COVID. So we urgently need to clean indoor air. And I highly recommend this paper that I've highlighted underneath, the Nature paper by Professor Zayed Ali, that goes into a very big picture view of the global long COVID science research and policy landscape as it is today.